another edition of Conversations with CASA, a monthly show produced by Texas CASA that focuses on issues, trends, and resources impacting the child welfare system. My name is Vicki Spriggs. I'm the CEO of Texas CASA, and my guest today is Erine Gray. Erine is the founder and CEO of Austin-based Aunt Bertha, the leading search and referral platform in the United States, serving millions of users, most major health plans, hospital systems, foundations, and tens of thousands of community-based organizations. Findhelp.org is Aunt Bertha's free search tool, which connects any and all people in need to the programs that can serve them. Erine, we're very excited to have you here today to talk about this amazing platform and how it can benefit the work of CASA. Welcome.
Thank you, Vicki. It's an honor to be here. As I mentioned before, I've known about CASA and the difference you make. We have at least one employee that I know of that is a CASA volunteer, and good friends that have as well. And just to have a chance to talk with you is certainly my pleasure.
Well, thank you. And I think you told us you've actually run in some of the local races too, at least one, right?
Yes, when I am getting back into running, and we actually just started a running program with our company, and for this one in the fall, we're doing the Run for the Water in November. So we're all trying to get in shape together, and of course, the weather broke here in Austin, and we're very much looking forward to it.
Yeah, I bet you're happy the weather broke too, but because it's been awfully muggy and hot. And how far is your run going to be? Is it a 5K or?
Well, you can either do the 5K or the 10 miler, but I'm only doing the 5K because I'm trying to get in shape again, and I couldn't run 10 miles if my life depended on it right now.
Well, speaking of your life, can you tell us a little bit about yourself and the origins of Aunt Bertha and findhelp.org?
Sure, yeah. So our company was founded 11 years ago. I'm the founder, and it's a lot of things happened that led me down this path. I'm from a small town in upstate New York, about an hour south of Buffalo, about a 20,000 person town. And in a small town, there's not a lot of jobs. And, there was a brain drain that occurred in Western New York, where the kids that would go off to college and they would never come back. And while I was in high school, my mom had a rare brain disease called encephalitis, which caused permanent brain damage. It was right before my 17th birthday. And so she went into the hospital for a few months. And when she came back from the hospital, she had no idea who I was because she lost her memory. And it was really fascinating because she lost the most recent 20 years of her memory, but she remembered what her life was like before those 20 years. So it was a journey. And one of the most memorable nights of my life was when she wanted to go visit her parents after she got back from the hospital. And she just thought she was going to walk over to her parents' house. But because her memory was gone for those 20 years, her parents had died since then. They were in their 70s at the time. And so they had been dead for at least 15 years. And so when dealing with somebody that has amnesia or doesn't have that memory, and being from a small town and not being a wealthy family, we were blue collar family like everybody else. I just learned very early on that life can throw you a curveball, and we're not always ready for that. So I went off to college and got my degree and moved down here and got a job as a contractor to Dell Computer, which is what brought me down to Texas. And a couple of years later, my dad got sick, and so I became my mom's guardian. And so I was there and trying to help navigate for her care. And we're very fortunate in that she is in a good 24-hour care facility with a skilled nursing facility, and gets good care from the nurses and the staff that are there. But I learned so much about what happens with people who have a disability and maybe aren't quite old enough to get 24-hour care, or maybe there's some behavioral health or mental health issues, and decided to dedicate my life to working in health and human services. And so I went back to school and got my master's at the LBJ school here in Austin, and spent about 6 years working in government after that, and sort of had this idea that to build a search engine for social services. And that's where Aunt Bertha was born. So we've since changed our name to FindHelp, and we launched findhelp.org during the pandemic last year to really just, it's a little bit more intuitive of a name. And a lot has happened since then. And here we are today, because as a result of the pandemic, millions of people became unemployed for the first time and didn't know where to find resources. And so now we work with over 7 million users and many of these organizations that you mentioned. And it's fulfilling work, and it's exciting to be doing that right here in Austin.
Wow, that's incredible. I have to ask, as it relates to your mother, that gap in memory, can she remember going forward now? Or is that gap, is it just that, not just, is it that 20-year gap forever? And she does remember everything from that point going forward, or?
Well, not really. So her short-term memory is a challenge, but as she's aged over the last, I guess it was 1992 when she got sick, so 29 years, she now has dementia and is on all sorts of different medication. But over the years, memories have popped up in during that period, and so we would be having a visit, and I was talking about my niece Hannah, and I leaned into my mom and I said, "Do you remember where that name came from?" And she leans in, she goes, "Shannon's doll." Shannon is my little sister, and she had a Cabbage Patch doll named Hannah.
Oh.
And my jaw dropped. I almost teared up, but those little memories have popped up. And of course, she recognizes us, but COVID has changed the cadence, of course, that we can see her. But the brain, it is a fascinating thing. And it's fascinating as it is without sort of memory loss or brain damage, but sometimes we're surprised, and sometimes we have completely coherent conversations. And other times she doesn't know who I am. So it is just one of those things.
Yeah. Thank you for sharing that. Back to well, I have to ask, where did Aunt Bertha come from? And then, and you're right, findhelp.org is much more intuitive.
Yeah.
So, so if you could just talk about where did Aunt Bertha come from in terms of the name, and then if you could talk about, for our listeners especially, it's like, I know why you're here. We still haven't really made it clear to them the array of services available on your site. So can you talk about where the name came from, how someone, or how findhelp.org is helpful to both a CASA volunteer who's trying to advise a parent, or a parent or anybody out there who needs a certain kind of service?
Sure. Well, so I was a programmer by training, and not a marketer. And so after I worked in government for 6 years, I sort of had that colloquial play on Uncle Sam. And so my original idea was, a very matronly like figure that you go to in your time of need. And I thought, well, and this was just an idea that occurred to me, maybe I'll try to use Aunt Sue. So I went and tried to reserve the name, domain name, and it was available, but you had to purchase it for $3,000. And then I thought, well, I could buy the domain name, but I'm about to start a business and bootstrap a business, and $3,000 is a lot of money. So I went back to square one and researched baby names from the 20s and 30s. And then I landed on Bertha or Martha. And so I consulted my younger sister, Shannon, and she liked Bertha. And so I went to register the domain name, and it was $13.95.
Well, there you go.
So there, the decision was easy. But it was subconscious at the time, but my mom in many ways was that eccentric person. She raised 7 children. We were from a mine, his and ours family. My dad had 4 children before he met my mom, and he was divorced, and but he had sole custody of the kids. And my mom had a daughter, my older sister. And so when they met each other and got married, on day one, they had 5 children in the household. And then they had me and my little sister. But over the years, there were at least 2 incidents where she took somebody in, 2 different periods, 2 teenagers that were in their last year of high school, and they moved in with us. And so she always had such a huge heart. And I think part of it was a subconscious, if you will, tribute to her, and that sort of loving heart that was there. And the thing is, what I wanted to reiterate is that everybody in life struggles. Some are better at hiding it than others. And regardless of how much money we have or how whatever our background is, we can't escape the fact that we need help sometimes. It may not be related to unemployment or paying the bills. It might be related to a rare illness, or a cancer or whatever. And so the whole idea being is that I wanted an experience, a user experience that let people know that it's okay. And so this year, we are in the process of changing our name to findhelp, because I think we've exceeded beyond what I originally thought was possible, in that we have hundreds of thousands of users, and many of them are in the middle of the night. So using services. So we've seen somebody searching for help in a Motel 6 from 2 in the morning until 6 in the morning. And they're looking, and you can imagine if you're on our site at a Motel 6 and you're looking for help, probably is the fact that you probably can't afford to stay there any longer, and so you're looking for a home. But then we also see searches for runaway services at 1 in the morning at a kiosk in New York City. And you could start to imagine that kid, they're looking at, I don't know who they are, they haven't identified themselves, but they're looking for youth runaway programs at 1 in the morning, and it just sort of breaks your heart, but also it gives real meaning, to the work. And so many of our users, or power users, as they say, or we use the term navigators, are people whose job it is to help others. And maybe it's a volunteer, or maybe it's a professional social worker, that they go over to somebody's house and they discover that the mom might be stressed out about being able to pay her light bill, or feeling embarrassed because it's back to school time and they may not have the money to buy school clothes or get the backpack. And so we've seen volunteers that find free backpack programs through the search. And really, we see ourselves as connectors. And we don't do the hard work of packing all the backpacks and giving them away. Those are the wonderful nonprofits that are out there doing that work. But certainly a resource that CASA volunteers and others use in their day-to-day interactions with the folks that they serve.
So a few thoughts come to mind. One, you have an incredible set of parents, clearly. Two, you certainly inherited so many of their wonderful traits. So thank you for that. Three, I think anybody watching who may wonder at any point in time, if I'm doing whatever X is, am I making a difference? What you're showing everybody is one person can make a huge difference. So having said that, I also want to ask you, because your service is national, how do you stay up to date? How do you keep current? How do you keep the information current?
Yeah, that's a great question. It's hard to do that. We have it is a moving target constantly, because if you think about it, nonprofits that serve others, the funding changes on a regular basis. Raising money is hard work, and so it comes and goes. It's highly sensitive to the economy. It's sensitive to the changes in population, and then with government programs, eligibility rules change over time. And so the way that we approached it was to hire folks that are based here in Austin as part of what we call our data operations team. And we hire folks all the time. We have about 50 employees in that team. We have about 200 and some total now, but that team is responsible for building relationships with those services that are out there, and making phone calls, checking the website, sending emails to make sure that we have the most accurate information as possible. And so we call that a shared services model, where we do all that work so that our users don't have to, and our customers don't have to. It used to be that every one of our customers, who tend to be hospitals or health systems or foundations, would staff somebody to try and keep the local services up to date. So because we do all of that in-house, we achieve some economies of scale so that our customers don't have to. And so we do have a paid product for people that tend to employ large groups of navigators and social workers. And so essentially our customers sort of subsidize that team of 50 people and cover their costs. So that's one way that we keep the information current. The other way is that people tell us when things change and we're unaware of it. So for example, if you knew about a new program that CASAs of Austin stood up and we haven't found out about it yet, in a couple of clicks, they'll let us know that a new program is available, and that prompts our team to go and make that call out to CASAs to make sure that we have it listed. And then lastly, and we're doing more and more of this, many nonprofits claim their listing on findhelp.org, and we give them free tools to make the updates themselves on the fly. And we're starting to see that grow because they want to make sure that they get their listings are accurate as well, and so that they don't get requests for services that they can't help people with. So it's a three-legged stool. It's a combination of all those three things, but it's our biggest investment, and it's something that we spend the most time on.
I can imagine. I've been involved with other nonprofits, well, for people in Texas, the Texas Network for Children, or the Regional Network for Children if you're in the Austin area. And we used to produce a manual of services, and it was almost out of date every year. The day it came out, it was almost out of date because things come into existence and go out of existence so quickly in the nonprofit world, just for all those funding factors that you talked about. So yeah, I wondered about that. So I can imagine that it's your biggest investment. I know that you referenced this, your population, because of the pandemic, your numbers of users just skyrocketed, I would imagine, almost overnight. because it's a web-based service, there's no line for people to get on. Anybody can access the service whenever they need it, correct?
Exactly.
So yeah, so any CASA volunteer who's working with a family or who might themselves want some information for themselves, either to use to reference for somebody else or for themselves, um, would find that they can help themselves, they can help the young person they're working with, they can help that young person's family by accessing findhelp.org. Um, is there anything, because you know about CASA, you're slightly familiar with it, um, and you know where you're going with the vision and the mission of your organization, is there anything that you would add that a CASA volunteer might need to know or want to know or should know um, before we start wrapping up?
Sure. Well, the most important thing to know is that um, is that for a CASA volunteer is that using the service is free. We don't do any creepy data stuff like the things that are happening in Silicon Valley. And it's completely anonymous. So if you're helping your the family of the kid that you're supporting, you can just send them links if you wanted to. And that information is between you and the family. They don't have to create an account. If they wanted to just dial a phone number of a nonprofit that can help them, they could. And that's completely okay. We really value anonymity because your CASA volunteers, they discover all sorts of situations that are out there and that are tough. And many people don't want their toughest moments to define them, for the rest of their lives. And so we very much value the anonymity of the service. Now, if you wanted to make a referral for somebody, or some organizations that we work with set up what's called screeners. And a screener basically is an application for benefits. So if you're navigating on behalf of a family that you're supporting and you want to help them apply for free or reduced cost social service, you can totally do that. And in that case, you do identify yourself, but don't worry about it because that information is only shared between the family and the application, the nonprofit that they're applying to, and it's just to get them connected. So the point being is if you make things really simple, it's hard enough to get the nerve to raise your hand and say, I need help. And so letting people know about the resource so that when they are brave enough to raise that hand and ask for help is totally okay. And we do have some new findhelp.org cards that we can ship out to any CASA volunteer in the state of Texas. So feel free to email support@bertha.com and we'll ship those right out to you.
Super. Thank you so much. I really appreciate what do they say? When your life brings you a test, you can fail the test or you can make it a testimony. And what you've done is create a testimony. And it's a testament to the compassion that you were taught growing up and that you are wanting to give and share with others. So thank you for your vision and the creation of Aunt Bertha. You can tell I'm a Yankee because I still say aunt as opposed to Aunt Bertha. But thank you for that. And thank you for, you live that compassion because as you talk about it, you are so present. And I just Really appreciate you, and I really thank you for spending your time today to come share this wonderful resource that you've created to give away with us. So thank you so much for being here.
Oh, thank you, Vicki, for the kind words, and it truly was my pleasure.
Thank you. And thank you for joining us for this edition of Conversations with CASA. We hope to see you next time.